Thank you very much. Thank you, Jerome, again for the invitation, and Klaus as well. Very great pleasure to be here. I learned a lot of things, incredibly a lot of things. Nice round. Talking about bilateral cataract surgery and the data that I take for this presentation, we have published with our groups a few years ago on this topic. Bilateral cataract surgery, whenever you do cataract surgery, this is a question that the patient asks you. How you do it? Do you do both eyes or one eye? And especially patients for refractive lens exchange or whatever, they have always this attitude to ask, can it be done quickly, both eyes? And they have this idea that the vision will be quickly restored. So, but, however, it is not routinely performed. And why? Because the biggest fear is basically that we have that the patient could have a bilateral sight-threatening complication like infection or whatever, which could compromise the vision in both eyes. So you don't want this. So, as with every procedure, and in Switzerland anyway, you have to really evaluate the benefits and the risks of this procedure if you want to recommend to the patient. Finally, it is still very, very controversial, and a couple of weeks ago there was an editorial in the Australian Journal of Ophthalmology, the Clinical and Experimental, I got this to read, on this topic. So what are basically the positive things if you do bilateral simultaneous cataract surgery? It is more cost effective.
Sorry, 1 second. In addition,
if you do it on the same day.
No. In addition, Canada experience.
Yeah.
The second group worldwide is the surgeon in Canary Island.
Yeah. This is this. There are regions on this world. This is absolutely like this Canary Island, where it is the. Are you from there?
It's no. A guy.
Sorry to tell you. I am sorry.
Okay, so they're really they're not in Switzerland, but there are really regions where this is routinely performed. Huh? Absolutely, you're absolutely right.
We are friends.
More cost effective, of course, more convenient for the patients, especially the elderly patients. This helps the post-operative appointments, of course, and of course you have quickly done both eyes and the vision is the same. Of course, again, for the elderly patients, eases the demand of support of infrastructure, for especially mobility, restricted patients, elderly patients. You know how it is. Sometimes a 90-year-old patient is not that mobile. You have to organize a second person to bring her in the hospital, bring her back, and so on. So it's quite intensive. Negative things, I mentioned one thing in the background is the potential risk of bilateral sight-threatening complications, which is number one, the endophthalmitis. And the second thing is that you cannot refine your refraction or the selection of the appropriate lens.
Surprise.
It's a little bit could be a surprise in the second eye as well if you have the first eye. So, what was basically the idea behind the studies was to examine the efficacy and safety of these bilateral cataract surgeries. It was a retrospective study. We did it on all consecutive simultaneous bilateral cataract surgeries from 2000 to 2013. There were 250 patients, more women than men, and the mean age was 80-year-old, and the oldest one was 106. It's a lady. This is the lady, the 106-old lady. 2 years later, she was 108.
Are you sure?
Yeah, very surprising that she's still. And in Switzerland, when you get older, from 100, the mayor of the town is coming to congratulate for the. And every year, so there were even the journals. She gave a small interview for a journal, and what she said.
Das Frau is Freiburg, from Freiburg.
No, it's not from Freiburg. It's from close to Zurich.
Okay.
The journal, and she is also living there, close to Zurich. So she was talking about her life with her shiny, it is in German written, shiny eyes, and I think it's a little bit because of this bilateral shiny cataract surgery that we have done 2 years ago. What is basically the methods? The method is cataract surgery, but you have to take care how to perform them. And there is Presbymania, there is a group of Presbymania, which is a very exquisite group. And there is also a group of International Society of Bilateral Cataract Surgery. So, as you can see, for everything there is a society. I met this president as well once, the big, Steve Arshinoff, and the big difference is you have to pay to be part of the group. While we are...
It's the video, yes?
Sorry. I thought it's a question. So this group outlined criteria to follow when you do bilateral cataract surgery. And as we are in the Holy Land, it's like Moses coming down from the Mount of Sinai with the 10 commandments or commitments. And it is the same in bilateral cataract surgery. There are kind of 10 points to follow to keep the safety on a high level when performing this surgery. And number 7 is, in my eyes, maybe the most important thing, is that the complete aseptic separation of the first and the second surgery, which is basically said that you both eyes, you do both surgeries on both eyes, but completely as it would be a second patient. Total new equipment, you go out, you wash yourself, you change yourself, you wash the patient again, and so on. So these are the results of these studies. We had less, from the point of view of vision, less than 3% of loss of vision. Most of them was from a retinal point of view a problem. Progression of AMD. We had conversion of wet to dry to wet AMD, and so on. So there were a few patients basically with a loss, but of course the majority had a benefit of the surgery as it is after cataract surgery. So the second thing is the point of refinement of the IOL selection. And we had really 20 patients that had a postoperative spherical equivalent in the first operated eye over 1 diopter. 14 eyes had ocular comorbidities. As I said, they were really elderly patients with AMD and so on, where with restrictive factors where you couldn't really refine something. And there were really 6 eyes that you would say, in these 6 eyes, I could choose something, another lens, if I wouldn't do the surgery bilaterally. Now, 4 of these 6 patients had in the second eye a spherical equivalent, this retrospective, as I said. However, an spherical equivalent which was less than 1 diopter of the intended spherical equivalent. What means this? If we have chosen something else than what was chosen, might be that we would end up with even a worse result. So it's very difficult. Of course it's a retrospective study, but this was real life. Real life. Complications, we had to, thank God, no bilateral complications, no sight-threatening complications. There were all over. I grouped this in intraoperative complications. This was kind of capsular rupture or sondular lease. I grouped everything inside, and we had 4% of postoperative complications, which were transient pressure, and so on. In Switzerland, there is a lot of things which, as Dr. Beauvais has told us, that we are a little bit restricted on the law and basically on the refundment of the surgeries. And it was in the past, it was not paid bilaterally. And as you can see, in 2009, it's changed. So the amount of the surgeries over the years increased, as it was refunded by the assurances. In conclusion, so bilateral cataract surgery could be an effective and safe option. In Switzerland, there is a little bit of growing popularity to do this. However, as with every surgery, proper patient selection and high standards are mandatory. As if you do this everything properly, you could have equalized this theoretically enhanced risk of a side-threatening problem or complication with the positive or benefits things by the surgery. One small extra idea is the mortality with the road trip. So surgeries, I'm from Winterthur. This is in Zurich. This is Zurich is just from here. Here, so here is the airport Zurich. I'm here in the center. So the most patient came to the hospital the surgery 18 kilometers was the distance. So if we do a small calculation. When you do bilateral cataract surgery, there will be about 4 appointments together with the surgery. This means 18 cross 2, cross 4 times, sorry. 18 times 2 times 4. You have 144 kilometers per patient, which is when you extrapolate in the Swiss traffic, you will find 100 million kilometers, 1.48 deaths. So you will have in your patients 1 death by road accident. If you do the sequential thing, as normally, you have maybe, I would say, 7 appointments, which you calculate the same way, and you have at the end a relative risk, which is clear, of to die just because of the road of 2 times higher if you do sequential cataract surgery, and you don't die in a cataract surgery normally. Thank you.